Okay, so good evening. You guys should all see the title page of the lecture. So my name is Dr. Marc Hirsch. I'm a ophthalmologist in the greater Milwaukee area with a background in corneal disease and general ophthalmology. Just kind of a brief background of ophthalmology versus optometry. So an ophthalmologist is someone who goes to medical school. So it means that I did my 4 years of medical school, followed by 1 year of general medicine, followed by 3 years of ophthalmology, where we learn medical and surgical ophthalmology, followed by a fellowship in corneal and external disease. So I have an interest in Parkinson's, mostly because I have one of my grandmothers had Parkinson's, and as a general ophthalmologist, we're seeing more and more people with Parkinson's, and we get a lot of questions about the relationship between the eye and Parkinson's. So I'm going to get started here, and if you guys have any questions, there is a chat room. Feel free. We'll be monitoring the questions in the chat room. And then as we get to the end, I will hold off for questions, and we can answer the chat room questions or any questions from the group at that point. And how I got here in my history is I have a patient of mine who is very involved with a Parkinson's support group at one of the local assisted living independent facilities in Mequon. We spoke, and she ultimately arranged for me to speak to her group at the facility. And then based on that, I was asked, and very thankful to be able to speak to everybody here at the Wisconsin Parkinson's Association. So I think just to start off, from a greater perspective, Parkinson's disease does not cause blindness. That is a very common concern because the eye has a large neurologic component to it. However, most of the eye neurologic components are sensory tissue, and this is most of you probably are very educated and know Parkinson's is a motor neuron disease. So we'll get into some of the implications and impact of the motor neuron diseases on the eye, but if you have Parkinson's, you will not go blind from Parkinson's. And I think that's very important just as a take-home message, and something that hopefully will give you a lot of comfort while those of you who have this disease or have family members who are struggling with disease can have some comfort for that. So just a brief history or update on Parkinson's disease and how it impacts the eye. So it's a neurodegenerative condition. It's one of the top neurodegenerative conditions, along with Alzheimer's disease. The basic understanding, my level, is that it's caused by damage to a part of the midbrain called the substantia nigra, which impacts the amount of dopamine in the bloodstream. Dopamine is what's called a neurotransmitter, and the loss of dopamine is felt to be the major cause of the symptoms, and that's where the carbidopa levodopa is a replacement for the loss of dopamine. It's considered a disease that is impairment of motor control. It's considered the second most common neurodegenerative condition. And then how is the eye related? Well, as I said, we'll get into some of the motor control things, but interestingly, the sensory area of the retina, of the nerve tissue of the eye, is called the retina. It's basically the part of the eye that processes the light and sends the image to the brain. Those cells in the retina have dopamine, so there can be visual symptoms from Parkinson's due to the loss of the retinal cells, not just the loss of the substantia nigra. So the main symptoms in Parkinson's are very vague. They are as vague as any symptom that we would see, and that's what's called asynopia, which is really just eye strain. The patients will come in and they will say that their eyes just feel strained. That's about 46% of the symptoms in Parkinson's. However, that's a day in, day out symptom that comes into my office, and most, if not all, of these patients don't have Parkinson's. So eye strain is just a really common way that people describe all different things that are going on with their eyes. Another very common symptom is difficulty reading, which is another common symptom in general. So what the point of this slide is that there are not a lot of signs, or rather symptoms, that we call pathognomonic for Parkinson's. So if a patient comes in and they have a complaint of eye strain and they have not been diagnosed with Parkinson's, it's highly unlikely they have Parkinson's. If they come in with a complaint of difficulty reading, it's highly unlikely they have Parkinson's. Another third, probably most common symptom is double vision. And we'll get into that as well. So what's more important than the symptoms are the signs, so the ocular findings of Parkinson's. And we'll go into some of these in a bit more detail because a lot of these have things that can be treated. So the first thing is what is called a gaze defect. And there are different types of gaze defects. So gaze is nothing more than the eyes tracking across the plane of either up and down or side to side. And there are really two basic types of gaze defects. There is the saccadic movement and the smooth pursuit. So the saccadic movement is just a quick move to the right and to the left, or up and down, but right and left is much easier. But it's really just someone holding up their fingers and looking quickly to the right. That's a saccadic movement. Whereas a smooth pursuit would be picking up an object from far away and just watching it come across towards you, or the way an animal just gazes at another animal, kind of watching that animal when they're going to attack it or something like that. It's a very smooth way of looking at things. And so in general, it's the saccadic movements that are impacted by Parkinson's. It's a very slow movement, and that impacts a lot of the issues that people have going from reading to distance. Just their kind of jerk movements are slow. Another major symptom and sign is dry eyes. We'll get into that. And then a third one is called convergence insufficiency, which has to do with muscle imbalance. And we'll go into some of the double vision symptoms. And then finally, I'll talk a little bit about screening for Parkinson's in the eye. There's a lot of challenges with Parkinson's and all neurodegenerative conditions because the screening tools are really limited. There are MRIs, which are probably getting deeper in the weeds than my understanding, but to my knowledge, there just really isn't a good, certainly not a good blood test, certainly not a good MRI scan, and not even a PET scan that really can determine Parkinson's, whereas imaging of the eye is a very non-invasive way and cost-effective way to screen for neurodegenerative diseases. Very popular area of research, but not something that we're doing at this point. So going back to the saccadic eye movements and the gaze defects, so at 75% of Parkinson's patients will have a delay in their saccadic eye movements. That delay is very difficult to measure. We don't have a test in our office that measures saccadic eye movements. So it's very much what you would just hold up two fingers and have a patient look, or maybe hold up a pen, have them look straight, and look at the pen, look straight. And it's very subjective. There is research in developing instrumentation to quantify saccadic eye movements to see if there could be a way to pick up Parkinson's with saccadic eye movements. That's the latency that we're getting to. The other eye movement that's very common in about 50% of the patients is what's called gaze restriction. And that's usually difficulty in looking up. So about half the patients have that. And so a very common thing is a patient will say, I'm reading and I look up to look in the distance, and it's really difficult for me to do that. That's a lot of times that's gaze restriction. Fortunately, if you're starting off straight ahead and you look up, unless you're an outfielder for baseball, there's not a whole lot that you do looking up like that. So although that's very common in patients with Parkinson's, it's not tremendously bothersome. But what's very bothersome is you're looking down and then you look up and it's just a very slow gaze. Another very common condition is dry eye. Dry eyes can be part of the earlier symptoms that I was talking about relative to eye strain. One of the motor issues with Parkinson's is the blink rate will decrease. So some of the muscles around the eyes don't work as quickly due to Parkinson's. And as a result, you get tearing, grittiness, and blurred vision. To tear or water because of a dry eye seems very counterintuitive. There's two reasons why people might get watering of their vision when they have dry eyes. Number one is that when a person closes their eyes, there is a squeegee type effect that moves the tears towards the nose, where on the inside of the eyelid, there's a small opening where your tears are supposed to drain. So when people don't blink, the tears start to run out other directions as they well up in the eye. The other problem is that when the eyes get irritated because of the decreased blink rate, the body starts creating more tears as a result. And so that's how you get sort of the reflex tearing. Fortunately, this is a place where you can really do a lot of treatment for patients. One of the challenges for Parkinson's patients is that what is kind of the mainstay of artificial or dry eye management is placement of artificial tears. And we all know that tremors are very common in Parkinson's. And so putting in an eye drop for any reason is very difficult with a tremor. In fact, when I do cataract surgery, I'll occasionally have patients who have Parkinson's get other types of treatment modalities at the time of surgery so they don't have to be so dependent on putting the drops in themselves. Fortunately, many patients have caregivers who can assist with the application of teardrops, but that's not something that necessarily people want. Even if you have a caregiver, people rightfully don't want to lose the perception of their independence or actually lose their independence. And so one of the nicest ways to address dry eyes is something called a punctal plug. A punctal is a description of the little opening that I was talking about earlier called the punctum, Punctum. So the punctum is the very beginning opening which leads to a drainage duct which goes into the nose and opens into the back of the throat. That's how come you will taste a drop when you put it in your eye. So we actually put a silicone plug that acts really no different than a plug of a drain, except there's a small opening in it so it doesn't completely clog things up. There is a punctum on the upper and the lower. You can plug both, although usually just plugging the bottom one is sufficient because with gravity, 90% of the tears go through the lower punctum. There are even patients who have punctal plugs that constantly fall out. And those patients will do what's called punctal cauterization, where we numb up the eye and we heat the punctum and we scar up, and what we do, the heat does what's called coagulate or close the punctum that way. So a very easy way to treat dry eyes. It works very well and a very common condition. Diplopia is another common symptom, and this goes into a condition called convergence insufficiency. So convergence is a description of what the eyes do when you're going to read something up close. Both eyes go towards the nose as you read up close. They converge, as opposed to when you're looking up after reading, they have to diverge. So actually people do have something called divergence insufficiency. Nevertheless, about 38% of patients notice double vision, and most of them have this condition called convergence insufficiency. So there are a couple of ways to measure convergence insufficiency. This is a patient where we're showing the very bottom. That is a little image with little card with images. And what you would do in a situation like this is you would hold a pen out or anything, and you would pull it very close to your nose, just like I'm doing here. And as you get closer, you'll feel your eyes start to strain, and then the pen will double on you. And as it doubles on you, you can kind of hold it, and then it just stays double. The distance from your eye to the pen should be at least 15 centimeters. So, in America, we work in metric system less often than the other rest of the world. So 2.54 centimeters is an inch. So we're looking at about 6 inches. So if you can't bring your pen to about 6 inches away from your eyes without doubling, you might have a problem with your near point of convergence. And that's convergence insufficiency, again, very common with Parkinson's. It's not that the muscles necessarily aren't working well, it's probably something going on in the midbrain. You can also actually quantify the convergence insufficiency by doing up on the top image here what's called fusional amplitudes. These are called prisms. And so in this situation, this prism strength goes up as you go farther down this bar. And so the bar, you go higher and higher and higher, and you can quantify exactly where that person gets double vision. So one way to sometimes treat convergence insufficiency are eye muscle exercises. So you do exactly what I'm doing here, and you bring it in, and when it doubles, you just close your eyes and rest them, and you bring it back out. And you do that 15, 20 times a day in one session. And sometimes you can kind of move the needle a little bit to help with the symptoms. However, you can actually get special glasses with these prisms that are called base-in prisms, which weaken the need for the eye muscles to move towards the nose. And so you can get a pair of reading glasses with special prisms and get very, very comfortable with this condition. Some other just general concepts of Parkinson's. Due to the posture that a lot of people with Parkinson's develop, kind of this hunched over, stooped posture, bifocals and progressive lenses can be very difficult to wear. When somebody fits a bifocal or a progressive, you're usually fitting it with the idea that your head is looking out parallel to the ground. If you're walking around like this, you can imagine when you look up, you're not going to be looking up through the correct part of the glasses. On top of the fact that your glasses are going to slide down your nose much more. So a lot of patients just really struggle with bifocals and progressives and do better in single vision glasses for certain activities. We do see some patients who mention problems with color vision. We think that some of that is related to the dopamine loss in the retinal cells. Some of you, if you go back to your early high school biology, will remember the rods and the cones. The cones are the color vision cells. Those are in the retina. So perhaps those are somehow getting damaged. or not working well. Another common condition is loss of contrast sensitivity. This is a very hard thing for us to measure in the office. When you go to an eye doctor's office, we haven't updated our eye charts from a technological standpoint, probably in hundreds of years. We still use a very dark black letter on a bright white background. That's called a high contrast way of looking at things. In more research, they change the contrast. There's all different ways to change the lighting. And we find that people with Parkinson's have worsening vision in dim light, which can be improved sometimes with yellow color lenses. Yellow lenses are called blue blocker lenses. You might hear a lot about blue blocker lenses. They come in and out of fashion. A true blue blocking lens is a yellow lens. The lenses that you buy at some optical dispensaries now, which are telling you that they're blue blockers, they don't really block all of the blue light. That's why they're not yellow. So the yellow lenses are really blue blocker lenses. So are there eye exams to screen for Parkinson's? Unfortunately, there aren't. I really can't offer patients or neurologists much help in whether a patient has Parkinson's or not. Routine eye exams do not detect Parkinson's. It does not mean you should not have a routine eye exam. Most people with Parkinson's, based on age, need routine eye exams for a number of other diseases that can occur. We are, in our field, looking at whether, as I got to before, certain types of photography may hold some clues. Perhaps the appearance of the blood vessels of the eyes might be a way for us to discern Parkinson's. We're still working on that, but as of right now, a basic color fundus picture of the back of the eye is not very helpful. So I think, for those of you who have Parkinson's and are wondering, who I should be seeing, what I should be doing, I just want to take a few minutes to kind of explain the algorithm of eye care. So somebody like myself, who's a general ophthalmologist, I have a next level type of patient or specialist called a neuro-ophthalmologist. Neuro-ophthalmologists are doctors who either have a neurology background or an ophthalmology background and have decided to focus just on the neuro-ophthalmic diseases of the eyes. They tend to be more at academic universities, and there are not that many of them. There are just a few in the Milwaukee area. I'm sure there's a few in Madison. And they probably are the most sophisticated, but in terms of getting to see them, it's not always so easy from a logistics standpoint. There are also doctors who work with prisms. These can be strabismus specialists. These are usually doctors actually who focus on children. They're called pediatric and strabismus doctors. Again, not too many of them. And there are actually optometrists that focus on neurooptometry. So they focus on some of the visual training to work on the gaze defects and the exercises. They also work on some of the different types of lenses, yellow tints and that sort of thing. So there's a lot of different routes that a person can take related to things. Again, it's a very challenging, frustrating disease, but you will not go blind from Parkinson's, which is, I think, one very positive thing. People get very nervous about that. So I think that's, just kind of a brief update. We did about a half hour, so I just wanted to take a few minutes and see if there are any questions. I'm going to mute myself, and we'll see if any questions come up.
Okay, my husband has Parkinson's and he has very, very dry eyes, and they're always red in the morning. And I put some eye drops in them and they burn. And I wondered, is that part of Parkinson's or is that just regular? He's 82. We do go to an eye doctor.
How are they the rest of the day after he wakes up?
They're much better the rest of the day. Lots of times he can't open them in the morning, and he tries to walk with his eyes closed. Once I put the lubricants in, it's okay. We do have an eye doctor that we go to, and he suggested that, but I just was wondering, is this part of Parkinson's or not?
Most likely not,
Okay.
because he had been sleeping all evening. This sounds more like something that's very common called blepharitis, which is inflammation of the eyelids.
Okay.
And you actually can oftentimes do what's called eyelid hygiene, just like warm compresses with baby shampoo. And the other thing that's very helpful is trying to be ahead of things and put in an ointment at night before bed, so that you kind of minimize how dry the eyes get during the evening. A very good product is called Genteel Severe Gel. It's not as Vaseline-like as other evening ointments.
Okay.
And that works really nicely, but I think
It's over the counter?
correct. Yes, it is.
Okay. Thank you.
Yeah, sure.
Okay. Okay.
Dr. Hirsch, one of the questions was, how many sets of eye exercises should we do each day?
So if we think we have the symptoms of convergence insufficiency, which would be the only reason I would advise exercises, which is the double vision up close, you want to do this movement. And I'll just get real quick. The most important thing with this movement is that it's very slow. You want to come in really slow. So what I'm doing is one exercise right now. One rep. Really, really slow. You would do that about 20 times in a row. And I would do that twice a day at the most. I don't think it makes much more sense to do it more than twice a day.
Right. The next question is, how does sunlight affect vision with people with Parkinson's?
I don't believe that, well, sunlight would not damage your vision because you have Parkinson's. So I think maybe what the question is, number one, does sunlight damage people with Parkinson's? No. I think sunlight can probably aggravate, some of the symptoms if you're having color vision issues or, contrast sensitivity. Usually with if you're being bothered by the sunlight, just a garden variety pair of sunglasses is good. They do make some sunglasses with side shields, but I wouldn't say that sunlight necessarily is certainly not dangerous, but wouldn't necessarily bother Parkinson's patients anymore. Sometimes being outside in the wind can impact the dryness quite a bit, though.
The next question is, I've had cataract surgery, may need laser. Could clouding of my lenses be Parkinson's?
No, clouding of the lenses is what would be almost considered a normal consequence of cataract surgery. The lenses always cloud. We really quote patients like 20–30% over the course of 3 to 5 years, but no, it would not be from the Parkinson's, and Parkinson's would not aggravate it anymore. Now, would you possibly have other dry eye or other issues that make a mild clouding more bothersome? Possibly, but the clouding in and of itself would not be Parkinson's related.
The next question is, are most people with Parkinson's still able to drive?
From a vision standpoint, absolutely. I have never had to stop a patient from driving because of their vision issues. I think that unfortunately some of the other motor abnormalities of Parkinson's impact the response time, but from a vision standpoint, I've never seen a patient lose vision from Parkinson's where they would not be able to drive.
The next question is, I have definitely noted a decline in night vision. I wear distance glasses when I drive at night. Normally, I don't wear glasses when driving during the day. Should I request or explore with my eye doctor getting yellow lenses for night driving?
So a very simple way to explore yellow lenses is in most Walgreens, that I've been into, they sell these glasses that are called night driving glasses with yellow lenses, and they fit over your existing glasses. They're fairly inexpensive investment. I think that would be a very easy way to explore it. You can certainly also buy them quite easily, I'm sure, on Amazon or on the internet. If you don't wear glasses, they're just basically wear them like sunglasses, and usually they're made to fit over. I would try those before I would really invest in yellow lenses.
The next question is, can you say something about visual hallucinations in PD?
Yes. I am not aware of visual hallucinations occurring in Parkinson's. That being said, I get patients with Parkinson's who have a number of non-specific symptoms like flashes of lights, in reflections, images. So I see it all the time. I think this is definitely something we don't understand. I don't know that I've ever seen patients increase carbidopa, levodopa, or Cinemac for that, but I mean, it's felt to be these kind of atypical symptoms are just part of the disease, but I wouldn't say it's common.
Okay, next question is, should people with Parkinson's take eye vitamins? Would this help?
No, eye vitamins are only for people with moderate macular degeneration. There are a number of eye vitamins over the counter. There's a specific brand formula that has been studied for macular degeneration. The rest are really non-proven, and most of all of them are geared towards macular degeneration or dry eye. I don't think I would take any eye vitamin for Parkinson's.
The next question is, if you have already been diagnosed with Parkinson's, should your eye physician do any additional testing with your annual eye exam?
So that's a great question. I think it depends on your symptoms. So if you have symptoms of eye strain or double vision, I think that you should have an evaluation for this disease, the convergence insufficiency. I do think that people with Parkinson's, they should get really scrutinized quite well for dry eyes. I mean, I think that's really, really common. I don't know what else I would necessarily do. You could get a color photo of the back of your eye, but the only value of doing that would be if for some reason down the road, there was a way to tell that there was something related to Parkinson's, and then you could go back and look and see what your eye was, 5-10 years ago. But those are not going to be covered by insurance, those kind of photos, and I don't know that there's really anything based on today to add. But certainly, if you're having symptoms of the eye strain, if you're having symptoms of the double vision, you should be evaluated for this convergence insufficiency. And also, you should be looked at pretty well for dry eyes, because those are two very easy things to treat.
Another question. I noticed my eyes taking a minute to adjust from brighter outdoors to dimmer light indoors. Is this Parkinson's?
So that is something that we see with aging of the eye in general. The chemical responses of the cells of the retina are slower in those situations, and it can be so many things. I don't know that I would say it was specifically from Parkinson's. I would be very, very hesitant to hang my hat on that. But if you go and everything else in your eye is normal and the only thing you have is Parkinson's, maybe. Sometimes it's something as simple as needing a different pair of glasses, though. So I think what you need to rule out the more common things like needing a new pair of glasses before you ascribe it to Parkinson's.
Can you hear me?
Yes.
Yes.
Okay. My husband has Parkinson's. He has convergence insufficiency in his eyes. has for a long time. He would like to know how to find a really good eye doctor that is good at prescribing the prisms, because he's had, in fact, he has prisms in his glasses now, I think, but it doesn't seem to help a whole lot. He hardly ever wears these glasses right now. And he has stopped driving because of seeing double. And also he sees illusions of things that aren't there sometimes as well. So I'm now the driver, but anyway, any help with finding a really good doctor that works with the prisms? He's been to the Eye Institute in Milwaukee.
I would probably be best to recommend places in the greater Milwaukee area. I would suspect in Madison, going to the university would probably have somebody. There are a few places in Milwaukee that I think have some opportunities. There's a Dr. Scott Keinitz, Kenitz, who does a neuro-optometry clinic in West Dallas, who's very good with prisms. I would probably start there. The neuro-ophthalmologists are good, but the optometrists can get more deep in the weeds with the prisms. So that's kind of who I like to use. There's another group who do some training out in the western suburbs, whose name escapes me, but Dr. Keinitz is interested in neurooptometry, and I think he's pretty good. In the third ward, there's Dr. Amanda Kopsick at Metro Eye, and Dr. Amy Jankowski. They're good. They're in the third ward in Milwaukee.
Any other suggestions, tips for those of us diagnosed early with Parkinson's? I am 52 years old.
There's really no medication. I mean, the best suggestion I can give you is to not worry about going blind, because it's not going to happen. That's probably the most valuable thing I could tell you at getting this disease at such a young age. You can try to be ahead of the dryness. If you're having any symptoms, I would always start with artificial tears. I like the Sustain brand, SYSTANE. I also like Refresh and TheraTears. I think it's probably a good idea just to get connected with an eye doctor, maybe once every 1 to 2 years at this age. That would be a little more frequent than the age-related recommendations, just to stay as things change. But I mean, the most important thing is that you're not going to go blind from Parkinson's. So you don't have to worry about that at all. I can see Barb's question.
Okay, great.
So my husband has Parkinson's disease. No, those two other diseases, macular degeneration and glaucoma, which are really isolated essentially neurodegenerative diseases of the eye, are not connected to Parkinson's at all. So it's not felt that Parkinson's increases glaucoma or glaucoma increases Parkinson's, and the same with macular degeneration.
Separate from Parkinson's disease, if your parent has macular degeneration, are you at risk for it?
So the short answer is yes. Macular degeneration is got a hereditary component to it. However, it's very complex. It's not considered something that we can ascribe percentages to. There are certain modifications you want to make in your life if you have a family history of macular degeneration. The most important one is not to smoke. We find that smoking quadruples the risk of macular degeneration if you have a family history. And I think, like everything else, what your basic hereditary risk factors are going to be impacted by your diet. We do see quite often that there's a large variability in the aging of the eye, and it seems very much impacted by the diet. So the better your diet, just overall, not necessarily with diet supplements, but eating a healthy diet is seemingly very important to the aging of the eye. I couldn't say that 3 meals, 3 servings of fish a day decreases macular degeneration, but people who eat healthy just seem to have better eyes. But don't smoke.
Great. There aren't any other questions? It doesn't look like it. Well, awesome. Thank you so much, Dr. Hirsch. Did you have anything you wanted to say?
No, I just wanted to say that I very much appreciate the opportunity to talk to you guys. And I know Parkinson's is going to be an incredibly frustrating disease, and hopefully as time goes on, we get better ways to treat it and diagnose it. And I appreciate all of your interest in learning about the eyes. There was one more question. Are all doctors familiar with Parkinson's? Yes. I mean, we all went to medical school. I think when you start to talk about dry eyes, that's a real low-hanging fruit for Parkinson's. I mean, we all treat dry eyes. Convergence insufficiency, as Nancy and her husband, mentioned, is really complicated. Diagnosing it is easy, but treating it is hard. So I think treating convergence insufficiency is very challenging. And I don't even know that that many doctors think about that. So we all know about Parkinson's, but we really think of it in terms of dry eyes. I wouldn't say it was something that was really top on our minds. Oh.
Awesome. Yes. Well, thank you. And thank you to everybody who attended. You will see a pop-up come up right away when you leave the webinar for a short survey. So we do ask that you please take that. That helps us with future programs. But again, thank you so much, Dr. Hirsch. It was wonderful information. I'm sure everybody really appreciated your time and great input.
Thank you, guys. Have a good evening.